The World Health Organization has declared the Mpox outbreak in parts of the continent a public health emergency of international concern. Now, the highly contagious disease has killed at least 450 people during the initial outbreak in the DRC. Let's discuss the significance of this development now. We're joined by Professor Salim Abdool Karim, Caprese Director. Prof, thank you so much for your time this evening. Of course, when we saw the news, a number of people were then concerned. How significant is this development?
Good evening, and good evening to all of the viewers. So when we look at the situation with Mpox, we already in 2022, the WHO had declared that Mpox was a public health emergency of international concern. But after several months, the number of cases went down, and so it eased and they lifted that designation. What we are seeing now is a different situation in that we are now seeing in Africa, there are now more than 3 times the number of cases now than they were in 2022 when we had the previous emergency. So there are many more cases. And what's disturbing is that the cases and the number of cases each week is going upwards. So we are now seeing a steady increase. So we've got lots of cases and they are going up. And what's additionally concerning is that the death rate, the case fatality rate, the number of people who have the infection who go on to dying, is now sitting at around 3%, which is much higher than we anticipated. And finally, we're now seeing new countries, 3 new countries in the last few weeks, reporting cases of Mpox. They hadn't had Mpox for several years. So we are now concerned that the Democratic Republic of the Congo, the DRC, has quite a substantial outbreak of a new variant called Clade 1B. And this variant is being sexually transmitted, and then from adults is being spread to children. And that this is now having a spillover effect into other countries. So all of those issues combined gave us enough grounds to advise the Director General of the Africa CDC to declare a public health emergency for Mpox in Africa, and then that was followed yesterday by the World Health Organization declaring it a global public health emergency.
Prof, is much being known about this new variant, or are we still seeing what the WHO is saying here, that, as you've just said, it's mainly transmitted through sexual networks? Is that the only thing we know? Is there further information?
It's really very unfortunate that we have a problem in that the region, the Kivu region in the DRC, where this outbreak has taken place, that region is politically unstable and, in fact, is in the midst of war. So the problem is that the basic systems are not in place. We can't even get the samples from the patients into the laboratory. That's how challenging it is. So there's very little research that's been done on this new clade. We need to know a lot more.
Sure.
Do our diagnostic tests work? Do the vaccines work? And so on. So there's a lot to know.
And speaking about that then, because when you look at what the regional director says and what Dr. Tedros at the same time says, that there needs to be a coordinated international approach here. But I wonder, how does the continent respond to all of this, given the developments as you've explained them then in the DRC?
So we know, Mpox is not new in Africa. We have had multiple outbreaks of Mpox over many decades. But we know how to control it because it involves basic public health measures in that you identify cases, you do your contact tracing, and you isolate individuals, and you prevent the onward spread of the virus. Now, that very traditional way works. It works regardless of what the clade is. And the problem we have now is that because of the political instability and the breakdown in healthcare services, these public health measures are very difficult to implement in the DRC. So while we can implement it in the neighboring countries, we're having great difficulty, and the Africa CDC is now putting in a huge effort to try and support their country, including there are discussions underway for a ceasefire. There's supplies of new diagnostic kits. There are more healthcare workers going in there just to try and contain the problem before it becomes a much bigger one.
And, you know, Prof, we often take for granted sometimes that, you know, we've seen it before and, you know, we know what to do. But there are some people who still say, what are you talking about when you're talking about Mpox and how does it spread? Let's speak to someone who's watching us tonight who says that you're talking about this highly contagious disease, but I still don't know the symptoms.
So Mpox has a range of symptoms. It can be quite mild at one extreme, or it can be quite severe. In patients who have severe Mpox, often they are immunocompromised and often from HIV. In the symptoms that you would look for, the usual symptom that's quite key is the rash. The rash, together with fever and arthralgia and joint pains and muscle pains, that's a very typical feature. Now, the problem is sometimes you can mix it with, you know, and mistake it for some of the other infections. So if you've got symptoms that sound like what I've just described, and you're concerned about it, then you need to go to a health practitioner, because that's a person who'll be able to tell you straight away whether this particular rash, it's hard for me to describe it, that particular rash is related to Mpox or not. And if not sure, just get a blood test done, because the test can give you a pretty good idea quite quickly. Because if you have Mpox, it is quite easy to then control it. Because if you isolate the patient, track down the sexual contacts, track down the people who live with that person, close personal contact, you can stop the spread of this virus.
And you spoke about vaccines earlier on, and I was reading the WHO statement as well. So are these vaccines, as you say, we don't know if they're working or they're not, but are they readily available is, I'm sure, the big question for some.
Right. So you can't think about Mpox vaccines in the same way that you think about COVID-19 vaccines, in that you can't just make the vaccines available to everybody in the community and say, line up and get vaccinated. And you can't do it because there aren't stocks of the vaccine available. It's a new vaccine. It's very expensive. It sells for up to $200 a dose. You need 2 doses to be protected. And so it's not something you can just make widely available. But it can be used strategically to stop the onward spread of the virus, and particularly to healthcare workers, to individuals who've been exposed and who are at risk. Those are the individuals, so that they are protected and don't spread the disease onward. So used strategically, the vaccine is a very helpful adjunct to our public health measures, but it doesn't replace the need for case detection, the need to identify cases, because that's the basis of the control of Mpox.
Prof, appreciate your time as always, and for arming us with information. Do appreciate it. That was Professor Salim Abdool Karim, CAPRISA Director.